Good evening, I'm Andrew Chang.
I'm Adrian Arsenault. Tonight, the second wave of COVID-19 crashes down on Canada.
What lies ahead of us if we don't see change now is frightening.
Millions of Canadians face new restrictions. Alarming models chart a disturbing path forward. And one province debates closing schools again. We have cross-country coverage of a turning point.
I've stopped sleeping as well in the last week or so.
Thousands of doctors sound the alarm as the debate rages over what should close and for how long.
It's easy for people to say, just shut everything down. We're taking a balanced approach.
And is it time for a national strategy?
It's almost unspeakable.
Also tonight, a neighborhood grieves after a 12-year-old boy is gunned down in broad daylight.
And what you need to know before you spend your money. Marketplace puts best-selling masks to the test.
That is remarkable.
2 words, thread count. This is The National.
The message has and continues to be clear. The message is stay home.
We have to consider all our options to break the wave.
Folks, I don't know what I have to do. Every single day I'm pleading to follow the protocols.
Concern echoes across the country as Canada reports over 5,500 new cases. Tonight, we have comprehensive coverage as the COVID story takes a turn.
We are tracking dramatic developments from coast to coast. On the same day, Ontario sets a new one-day record. Models show it could soon see more than 6,000 cases a day. In Quebec, the government is considering shutting down schools. Manitobans are under new restrictions today across the province, while hundreds of doctors in Alberta call for a much stronger response from a government reluctant to shut down an already struggling economy. And late this afternoon, alarming new models in BC show cases doubling every 13 days. This complex and worsening situation dominated today's meeting between the premiers and the Prime Minister.
So we'll get into all of that tonight, but we begin with the dire new warnings out of the country's biggest province. Magda Gabrisalasa shows us the alarming scenarios envisioned for just weeks from now.
This is a critical time for our province.
Today, Ontario hit a record high of 1,575 new cases. But new modeling shows Ontario's on track to hit 6,500 new cases per day within a month. That's with no new measures. Even if new measures were brought in now, within 2 weeks, the demand for intensive care beds will force surgery cancellations like we saw in the first wave. At the province's own news conference, an official was asked if further restrictions are needed.
If the, as you led off, if the goal is to reduce the number of cases and the goal is to reduce the impact on the health system, then yes.
The calls for the province to take swift action are getting louder. The NDP wants a 2-week circuit breaker shutdown in hotspots.
To break the chains of transmission and drop the case counts in Ontario.
The Ontario Medical Association, which represents thousands of doctors, today asked the government to lower the bar for locking down. But Ford was steadfast.
The approach of just saying shut everything down is not the approach we're taking. We're taking a balanced approach. How can you measure the depression, the mental health of businesses and the owners when all of a sudden they go belly up? They put everything they have in their lives into their small business.
The hotspot cities aren't waiting. Toronto is already adding more measures with an extension on its ban on indoor dining and gym classes. But this expert says the province's modeling shows talk of a lockdown needs to be on the table.
The later these measures come in, the harder it is to reverse the growth quickly.
Even with new restrictions, if they're implemented today, you'd still see growth for a little while in the cases and the mortality as it takes that time to filter through the system.
Magda Gabrisalasa, CBC News, Toronto.
Manitoba tightened restrictions province-wide today in the face of some awful numbers.
We're announcing more than 2,500 cases in 1 week and more than 20 deaths in 3 days.
And Manitoba again reported 9 new deaths, matching yesterday's all-time high. Another new record, the positivity rate for people who get tested reached 11%, and the province has Canada's biggest per capita caseload with more than 6,000 active cases. The new restrictions shut down gyms, places of worship, theaters, hair salons, and rec centers. And so now let's turn to hard-hit Alberta with Canada's second highest infection rate per capita after Manitoba. It announced a whole new raft of measures to slow COVID-19 today, but the plan falls well short of what many doctors have been calling for. Carolyn Dunn has the details and the reaction.
A final deep cleanse at this spin studio before a 2-week shutdown starts tomorrow.
We hope that the government isn't just throwing a dart and looking to see what happens and what works.
With cases surging and Alberta's hospitals starting to feel the strain, Alberta Premier Jason Kenney announced new mandatory measures, from self-isolation while awaiting his own test results.
COVID is starting to win, and we cannot let that happen. This 2-week push is our last chance to avoid more restrictive measures that I and most Albertans desperately want to avoid.
So in many areas, indoor sports are canceled, worship services need to scale down to 1/3 capacity, bars and restaurants that serve liquor will have to cut off service by 10 p.m., and employers are asked to reduce the number of people at work however they can. Everyone is voluntarily asked to drastically reduce social gatherings again.
If you can start meeting friends or family members via Skype or Zoom, please start today.
Today, hundreds of Alberta health experts wrote another letter expressing concern the restrictions are not enough.
It's just too late for weak measures. It's just too late. The fear is that our health system is in grave danger. We're imminently going to collapse.
Some businesses like this Edmonton deli are choosing to exceed the government restrictions by moving to takeout and counter service only.
We also all have families and people we care about and our own health.
It's likely to be weeks before it's clear if today's restrictions are enough to turn the surging COVID tide in Alberta. Carolyn Dunn, CBC News, Calgary.
Okay, so let's take a look at Canada's most affected provinces by the numbers tonight. Alberta reported 860 cases today, and BC also posted a new record 594 cases. Both provinces also saw more people hospitalized. Manitoba saw close to 500 new cases, a record number of people in hospital too. And Ontario posted that new record today, 1,575 cases. Quebec reported fewer, 1,400 cases, but its hospital numbers are worse. Now, Quebec has plateaued above 1,000 daily infections for more than a week now, with students accounting for a growing portion of the case count. And that has the Premier weighing the prospect of closing schools again. Alison Northcott explains.
More than 1,100 Quebec classrooms are closed, with students staying home because of cases of COVID-19.
Schools are a place of transmission.
To control it, the government is looking at temporarily shutting schools down, the first province to consider it in the second wave, possibly extending the Christmas break.
We've seen a very important increase also in classrooms that we had to close. So we're looking at this possibility.
I don't want them falling too far behind.
Mary Kennedy is a single mother of 4 who says even a few weeks without school would be hard.
Being out of school, it's hard to do the Zoom meetings with 4 kids. It's challenging. I can't do it. So they just sit home and play, and I do what I can, but it's not easy.
This parent says schools should close.
If everyone's worried about COVID-19 and the spread of it, that it should be definitely put into place that the kids shouldn't be all together and cooped up.
If the government does go ahead, it says it could extend the school year into July to make up for the lost time.
Teachers would not be happy to lose those 2 months in the summer that they count on quite a bit.
She says the province should have had more measures like distancing in classrooms and smaller class sizes to make schools safer.
We've got to get these numbers under control now.
Dr. Matthew Outen says masks in class for all students could also make a difference and says a longer school break might help.
It's like we need to hit the reset button.
The Premier says no decision has been made yet and that closing schools would be a last resort. Alison Northcott, CBC News, Montreal.
Now let's go west to British Columbia. For months, the province's case numbers were the envy of the whole country, but recently it's been struggling to manage the spread. Its new modeling today is worrying. Briar Stewart has the details and the calls by some to mandate masks in that province.
Over the past 2 days, more than 1,100 people in BC have tested positive for COVID-19 and 4 people have died. With cases currently doubling every 13 days, officials say it's putting a strain on the public health system.
And what we're seeing today and yesterday, numbers that make me slightly anxious, those reflect exposures that happened a week ago.
The surge in cases is centered around the Lower Mainland. Officials say it's been fueled by social gatherings and has spilled over into long-term care homes. There are more than 40 outbreaks at healthcare facilities.
This is a time to take no chances, to give COVID-19 no room to grow.
Over the weekend, BC rolled out restrictions, closing some gyms and banning social gatherings even at restaurants and bars.
I don't want it to be for naught. So I think we do need the follow-up. People need to be taking masks much more seriously.
Eli Gershkovich runs Steamworks, which operates a brewery, brew pub, and liquor store. While masks are mandatory at his businesses, he says a few customers who don't want to wear them have threatened his staff. That's why he wishes the BC government would make masks mandatory everywhere and require proof from those who say they have a medical exemption.
As utopian as it may be, well, we should trust people if they say they have a medical exemption. It needs to be enforced, and we need to use all reasonable measures.
Officials say it won't move to make masks mandatory because they believe most people are wearing them already. They hope that if everyone follows the restrictions over the next 2 weeks, the province can avoid any more closures. Briar Stewart, CBC News, Vancouver.
So there is a messaging problem with all of this, as health officials warn the second wave could soon swamp the entire system. Political leaders resist getting too tough as they try to avoid economic chaos. So what is the right message? Katie Nicholson looks at a growing push-pull effect.
Estelle Wigg knows Toronto Public Health says she's really only supposed to go out for emergencies. But then again, the stores are open.
I did just return something in the mall, thinking that I want to make sure that it's done before I'm not able to. But I know that I'm not supposed to be out. I feel like I'm doing wrong.
Doctors want the government to send a clearer message that more needs to be done to crack down on COVID. The Ontario Medical Association became the latest group to unite on paper, today pushing the government to lower the thresholds in its new COVID framework by as much as 50%. So when COVID rates go up, it's easier to introduce new restrictions.
Easing restrictions would be the wrong thing to do. And the reason for that is that we're seeing increased spread, we're seeing increased numbers, and we're seeing increased toll on hospitals and on the system.
It's all about keeping hospitalization rates at manageable levels so staff aren't overwhelmed by the second wave.
I'm feeling tired and I'm feeling scared and I am feeling frustrated. And I think if you asked anyone, we'd all say the same thing.
Frustrated doctors in Alberta, Saskatchewan, and Manitoba have already written their own letters to provincial leaders, demanding immediate action to get ahead of the critical care curve.
What lies ahead of us if we don't see change now is frightening.
That possible future already keeping some doctors up at night.
I've noticed, though, in myself that I've stopped sleeping as well in the last week or so, and I think it's just that anxiety building up again.
The difference from the first wave back then, there were more restrictions, and there was more goodwill from Canadians now weary from months of isolation. Katie Nicholson, CBC News, Toronto.
Now we have epidemiologist Rewat Deonandan joining us, and let's just stop and take a breath here. What do people need to hear?
They need to hear that in many parts of the country, we have hallway medicine. We have a stressed healthcare system that might actually break. So this is not about whether you or I or other people as individuals might die. It's never been about that. It's about whether our community might suffer extreme morbidity and the healthcare system might collapse. This has always been in the hands of individuals to control if we simply limit the number of contacts and exposures we have on a daily or weekly basis.
I heard someone put it this way today, that what people do today may determine who lives and dies this winter. Is that crazy? Is that overblown? What do you think?
It's not entirely overblown. I liken this to the butterfly effect writ on a large landscape. So my actions today, if I choose to go to a party or have people over to my house, might not affect me, but it might affect that older couple living a couple blocks away that might end up getting sick and dying. So pandemics have a way of showing how we are all connected. My actions will affect you and other people, absolutely.
I have 10 seconds left. Given what provinces have tried and where provinces have failed, will anything short of a total lockdown turn things around?
Yeah, extraordinary public health assets, deploy strategically, but we need to get the cases down first.
Ray Watt, Dunandon, thank you so much.
Thank you.
So here's another question. Is it time for a coordinated national response to stop the surge? Rosie will be here with that issue to talk about that in about 15 minutes.
At least 5 passengers aboard the first Caribbean cruise ship since the pandemic began have now tested positive for COVID-19.
I was probably overconfident. I did not expect this to happen. I looked at the testing and the social distancing and everything they were going to do aboard and said, nobody's going to get sick on the ship.
Well, the ship is carrying 66 crew, more than 50 passengers, most from the U.S. They are all under quarantine.
We are creating new and expedited immigration pathways for those living in Hong Kong.
The federal government is setting up a program to help Hong Kongers come to Canada. The program targets young people, offers a fast track towards permanent residency. This announcement comes a day after Beijing clamped down on Hong Kong's pro-democracy legislators. A 12-year-old Toronto boy has died from injuries sustained in a shooting this weekend. The suspects now face charges of first-degree murder. Greg Ross has the story of an innocent bystander and startling video of the suspect's arrest.
This video, posted online, shows the moment 2 men opened fire on another car in an apartment building parking lot. The targeted vehicle speeds off, the suspects close behind. 3 days later, this surveillance video shows the moment that 25-year-old Joanne Smart and 24-year-old Rashawn Chambers were arrested as they walked out of a downtown Canadian Tire. The 2 men had their charges upgraded today.
First-degree murder.
This cell phone video was taken just moments after Saturday's shooting. A crowd of people can be seen trying to help a 12-year-old boy who was hit in the neck by a stray bullet. An innocent bystander walking with his mother on a beautiful day after they'd been shopping. While police don't believe the boy was the intended target, they defended their decision to charge the accused shooters with first-degree murder.
He was hit as these men were attempting to carry out their plan to murder someone.
Police say on Saturday, Smart and Chambers were waiting in the parking lot of this apartment building for their intended targets. And when they arrived, the 2 men opened fire. 4 people were injured in the shooting, including the 12-year-old boy. Police believe the shooting was gang-related and confirm at least one of the suspects has a connection to a previous gang-related shooting.
I am asking you to put down the guns, to understand that indiscriminate shooting, no matter what your circumstance is causing you to kill your own brothers and sisters.
This anti-gun advocate also said politicians must do more to prevent this kind of violence. Police have confirmed that one of the suspects, Joanne Smart, was on parole at the time of the shooting. They say they're also looking for a third suspect, the man who was driving the car at the time of the shooting. They say he is also facing a first-degree murder charge. Greg Ross, CBC News, Toronto.
Daily coronavirus cases are rising in 49 states, but the White House seems to be focused elsewhere. At what point do these denials become dangerous? Up next, former Obama advisor Valerie Jarrett on Trump digging in and what could finally change his tune.
The overwhelming response to this powerful photo posted by a university grad.
Plus, not all masks are created equal.
If you look at that fabric, it has very, very large pores in it. Air can simply sail straight through it.
Putting cloth masks to the test. We're back in 2.
In the U.S., the coronavirus is not letting up, with new cases hitting yet another high. Today, more than 152,000 confirmed cases. That's the third record day in a row. Texas has become the first state to reach 1 million cases total. Michigan's governor today warned her state is running low on PPE. And Chicago's mayor became the latest official to urge people to cancel Thanksgiving plans. Now, while COVID anxiety certainly played a role in the U.S. election, the Department of Homeland Security says voter fraud didn't. A statement tonight declared the election the most secure in American history. Still, as Donald Trump refuses to concede to Joe Biden, as Susan Ormiston shows us, he's also neglecting the pandemic.
We've seen no sign of slowing here, and we're in uncharted territory.
Chicago, the third largest city in the U.S., has just slapped on a new 30-day stay-at-home order. Across the Midwest, COVID is spreading faster than since the pandemic started. The tally across the state's bleak. Just since the U.S. election, the rate of new cases up 46%, hospitalizations up 30%, deaths each day up 17%. Over 10,000 more Americans have died in the 9 days since the U.S. voted, burying President Trump's prognosis on the campaign trail.
COVID, 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 COVID. By the way, on November 4th, you won't hear about it anymore. It's true.
It isn't, and today no word directly from Trump again, holed up in the White House stewing over alleged voting fraud.
Right now, he's letting this litigation play out, letting his lawyers take the lead on this while he stays hard at work for the American people on COVID and other matters. But you will be hearing from the president. You hear from him on Twitter. You'll be hearing from him at the right moment.
Meanwhile, governors across the U.S. are trying to wrangle rising cases, 152,000 today.
Look, I'm worried about this virus. I'm not looking at what the merits of the case are. It would appear that Joe Biden is going to be the next president of the United States. But look, we just all need to take a deep breath.
Few Republicans are even prepared to say Joe Biden should get intelligence briefings.
Stop deliberately and recklessly sowing doubt about our democratic process and start focusing on COVID.
Barack Obama, who campaigned with Biden, says in a new 60 Minutes interview, Republicans ought to stop the pretense.
Republican officials who clearly know better are going along with this, are humoring him in this fashion. It is one more step in delegitimizing not just the incoming Biden administration, but democracy generally.
Susan Ormiston, CBC News, Washington.
Now, the transition time between presidencies is critical for security, for intelligence in particular. So what is not getting done right now, and what's the cost of that? Valerie Jarrett was the co-chair of the Obama-Biden transition team back in 2008. She is now consulting with the incoming president's team. We spoke this week, beginning our conversation with those lawsuits launched by the Republicans. Are you in a position where you are being briefed on the status of the lawsuits?
I haven't been in touch with the Biden transition team's lawyers. One of them in particular was our White House counsel, Bob Bauer. Their take is that the lawsuits are frivolous. Perhaps even more importantly, 12 out of 12 courts have thrown them out so far. And so I think it's a bit of a waste of time and energy when we should be focused on the smooth transition of power.
What sort of things are not getting done?
Funds would flow in order for the president-elect to pay his transition staff. They are up and running, and federal resources are normally used to pay their paychecks. The memorandum of understanding would allow the federal agencies, all of them, to share information with the transition team that is not publicly available right now. And that's everything from the presidential daily briefing that President-elect Biden would be entitled to receive, together with Vice President-elect Harris, and their people who have been cleared for top clearance for security purposes would be able to get those briefings. So obviously, a lot can happen over this period of time, and our enemies around the world would see us as being vulnerable in the event that there isn't this smooth transition of power and want to take advantage of that.
I think people remember that was one of the reports about 9/11, that the delay in the transition because of the recount in 2000 meant that there was a gap in counterintelligence sharing.
Well, that's exactly right. And as a result, a new regulation was put in place that would require this cooperation but it has to happen at the president's request. And so far, that has not happened.
At what point do these denials become dangerous for the United States?
Well, as President-elect Biden said, right now he is not concerned. You take it one day at a time. You hope that President Trump, at some point, recognizes the outcome of the election is clear. And I know that the team around the president-elect will be ready to hit the ground running. President-elect Biden said he's not considering a lawsuit right now, but in time, when the Electoral College gives their result, then my hope is we will see the Republicans who right now are remaining quiet in the Senate, although Republicans around the country are saying, okay, enough is enough. But when the Republicans in the Senate start to pivot, then I think we'll perhaps see a little more cooperation.
I'm curious what you make or what the team makes of the changes at the Pentagon. What does that signal?
Well, chaos, I suppose. It is unusual to have changes in the cabinet during the transition. They obviously disagreed as to whether or not the military should be used to enforce domestic laws. The secretary said he didn't think so. So I guess I'm not that surprised that that President Trump would do what he did. But all of that is in the short term. I think where the focus of the American people and the people around the world ought to be is the longer term. And when I say longer, I just mean January 20th. President-elect Biden has been very clear, rejoining the Paris Climate Accord, where Canada and so many other countries have been a part of it, and we pulled out 4 years ago, making sure that we rejoin the World Health Organization so that we can be a part of the solution, the international solution to tackle not only the COVID-19, but whatever else comes along. These are all the issues that President-elect Biden is focusing on, which are not only good for the American people, but good for the world. I know those of you in Canada, our close ally, our proximate ally as well, will enjoy a much stronger working relationship.
All right. Well, thank you very, very much.
Thank you so much. Stay safe.
You too.
Be well.
Up next, we go back to our top story. Rosie is here with that issue.
Hey, Adrian, we are looking at what these record COVID-19 numbers mean for the political response, the Prime Minister's message to the premiers, and whether it's time for a change in strategy. Chantal, Andrew, and Althea will join all of us right after the break.
I would hope that no leader in our country is easing public health vigilance because they feel pressure not to shut down businesses or slow down our economy. I urge the premiers and the mayors to please do the right thing. Act now to protect public health. If you think something is missing in the support we're offering your citizens, tell us. We will work with you as we have since day one.
A direct appeal there from the Prime Minister this week to the provinces and cities as much of the country continues to set daily records of COVID-19 cases. But is Ottawa doing enough? Do these high numbers call for a more unified strategy across the country? It's Thursday, and I'm, of course, here with At Issue, Chantal Hébert, Andrew Coyne, and Althea Raj. Good to see everybody. Let's start with why the Prime Minister said what he said this week and why he didn't name anyone in particular, Chantal, because it was clear that it was a message that was going to particular people. I'll start with you.
And it came at a time when it seemed that the four larger provinces were going in on different paths. Quebec and BC putting in more restrictions, Ontario and Alberta seeming to, in the face of rising numbers, still be trying to keep as much of their economy going as if there was a break between the approach of these provinces. I'm guessing if he named names, he wasn't taking shots at BC and Quebec, and he was more concerned about Ontario and Alberta.
Mm-hmm. Or even Manitoba, who was introducing a code red as he was speaking that day.
But the thing is, the Prime Minister spent part of the week talking to mayors, in particular in Alberta. Yeah. And what I found really interesting in those conversations, or what little came out of them, is that even mayors in Calgary and Edmonton who may disagree with Jason Kenney's approach still believe that the person who is driving this should be the Premier and not the Prime Minister through the Emergency Measures Act.
Right, and that conversation has started again the way it did back in the spring, Andrew, but perhaps what the Prime Minister said there was enough, I don't know, or did you think it was the right approach?
Well, it's not clear to me. I mean, you are seeing more voices calling for a federal response, a national plan, et cetera. It's not entirely clear to me why that would be preferable to the provinces, why the federal government is better placed to respond to events on the ground than the provinces are. This is not, by its nature, these are constitutional responsibilities, first of all, that are mostly provincial. The severity of the pandemic varies greatly, not just from province to province, but from region to region within each province. Now, that said, there is an issue of, is there some degree of spread from one province to another, and is there kind of an extra provincial dimension because of that? And there is an issue also of, do the premiers have enough incentive to want to really crack down on the pandemic in the short term when they're getting all kinds of pressure from their business communities not to do so, and prioritizing, I guess, short-run thinking over long-run thinking. I wonder if there's a role for the feds, instead of the Prime Minister either just carping from the sidelines as he's been doing, or invoking the Emergencies Act, if there's some way they can offer incentives to the provinces to do better. Maybe the provinces that get their infection rates the lowest get first claim the vaccines or something like that. But maybe a more incentive-based approach.
That's creative thinking.
Rather than simply
very
carping.
Creative.
Yeah,
but
it's creative thinking.
For the government of Canada to tell a province, you're going to get punished. Your people are not going to get vaccines because they're going to be rewarded. Sounds like the last thing you want to do if you want to control a pandemic. You want to address the places where it's out of control first, not those that are doing okay.
Okay, but the idea of an incentive is an interesting one, because you could say, Althea, we're going to give you more money to shut your economies down, but it's contingent on you doing that. Rather than just sending $19 billion to the provinces, you could say, do this in order to get that. Althea.
Well, the Safe Restart program, that $19 billion that you speak of, it was tied to targets and benchmarks. It was tied to the number of testing that you were doing. That money was tied, so you could continue that path if that's what you're looking for. I mean, in some ways, I think perhaps nobody took heed of the Prime Minister's warning back the night of the throne speech, where he had that national address under the guise of telling everybody that, the fall wave was going to be a lot worse and that we needed to prepare ourselves. And it seems that we've looked at what's happening in Europe and we've looked at what's happening in the United States, and we've been frankly slow to act. The Premier of Alberta's announcement today on Thursday, announcing a 2-week pause basically on high-risk activities, has been something that the medical professionals in that province were calling for last week. It seems like the provinces are behind. I mean, in Ontario, you see the Premier basically putting his hands up and letting municipalities take charge in Toronto and Peel, because the government doesn't want to take the appropriate steps or doesn't want to be seen to be responsible for the shutting down of many businesses. And we know that there are hundreds of thousands of businesses across the country who've said, hey, if we're forced into a lockdown light situation, if you would, like something like the spring, we're not going to survive again. At the same time, I think it's a bit preachy for the federal government to be saying, hey, provinces, get your house in order, when the government itself, I mean, they didn't table a rent subsidy bill, an emergency measures bill, until November 2nd. They wasted a month themselves. So I think there's blame to go around.
Chantal and then Andrew,
But at the end of the day, what will bring premiers to do whatever it is that Justin Trudeau would want them to do, which would be to act more forcefully when it comes to lockdowns, that's going to happen through pressure from public opinion. Polls speak loudly on this. You only need to look at the fact that Jason Kenney, who has been the most vehement in trying to keep the economy open, is doing the most poorly in the polls. There is not a single poll that doesn't show that Canadians want premiers and the Prime Minister to do what they have to do to take care of the pandemic before worrying about businesses. So up to a point, that public opinion pressure is going to achieve the results that people are seeking. And I will say that if anyone sitting in the place of any of those premiers would find that balance difficult to achieve.
Oh, for sure. Andrew.
And let's be clear, I mean, understanding that hindsight is 20/20, but every level of government has bollocks this up. Yes, the provinces have been too quick to relax the restrictions and too slow to put them back in place, but it was the feds, who shut down their own global surveillance system, that left a strategic plan on the table that was ready after the SARS epidemic, that failed to stockpile protective equipment, that, go down the list. So, we don't need a lot of finger pointing back and forth. And I'm afraid that it's a little too easy for the Prime Minister just to be seen there lobbing criticisms of the provinces without taking responsibility for his own share of the blame on this.
About 45 seconds for you, Althea.
I was just going to say, I think that maybe we're starting to see that happen where, like, for example, today we had Ontario and British Columbia come out with their modeling, and the numbers are so sobering that I think that, anybody who hears that Ontario's perhaps could have 6,500 cases at the end of December per day, if there's anything that's going to force you to stay home, it's the medical professionals giving you unvarnished, nonpartisan advice, telling you what's likely to happen if changes are not made. And I think that's what maybe the premiers are putting in the window, so they start taking tougher decisions.
Yeah, unfortunately, fear is the great motivator in this pandemic, and that's maybe what it will take again. Okay, thank you all very much. Appreciate it. Before we go, be sure to subscribe to At Issue, the podcast, for extra content, including the panel's take on this story.
I want to congratulate President-elect Biden and Vice President-elect Harris.
You can look for it on any major podcast app and our website, cbcnews.ca/thenational. And with that, I'll toss it back to Adrian and Andrew in Toronto.
And coming up, a young woman sends a strong message to her alma mater. Why hundreds of women responded to this post.
And is your cloth mask up to the task? We'll find out.
Welcome back. Hundreds gathered at Mount Allison University today to protest what they call a culture of sexual harassment on campus. It all stems from one allegation posted on social media, but as Kayla Hounsell shows us, more have now come forward, and they're calling for change at the university.
I was basically naked from the bottom down for everybody to see. He proceeded to slap me as hard as he could and run away with a smirk on his face.
That was 4 years ago. Michelle Roy was a first-year student at Mount Allison University. She and a number of her peers reported similar experiences with the same man.
The university really pressured us into doing an informal complaint, which means that there's no external investigation. Everything is really kept hush-hush.
Not anymore. Students are demanding action. Now about to graduate, Roy recently learned another first-year student had been harassed.
I couldn't graduate from this university knowing that I was part of an institution that was allowing these first years, barely adult students to enter an environment where they would just be victimized and traumatized.
So she posted these photos on Instagram, and in a matter of days received hundreds of messages from women who said they've been harassed or assaulted at Mount A, some dating back more than 20 years.
And it's been happening for so long. We all need to have a part in putting an end to this.
I want to see policy change, I want to see a solid action plan, and I want to see the mindsets of all of the students on campus change.
Today, the university is pledging comprehensive change, including increasing resources for sexual violence prevention and response, immediately establishing a prevention working group, including student feedback, and initiating a third-party review of all related procedures.
We've worked on sexual harassment policy at our university, but clearly we've fallen short, and we're sorry, and we're working to fix the problem.
Students say they won't settle for anything less.
And I don't think they have a choice but to completely destroy the system that they once had and rebuild it.
She says she feels heard and hopes to leave behind a better campus. Kayla Hounsell, CBC News, Sackville, New Brunswick.
Up next, retailers all over are making masks these days, but some are better than others. What you need to know to make the right choice. Welcome back. Months into the pandemic and with soaring case counts, there are still no standards for consumer face masks. So which ones are the most effective? Our colleagues at CBC Marketplace headed to the lab to put masks to the test. Here's Charles Ciagro.
In a matter of months, masks have become a multi-million-dollar business. But it turns out not all masks are created equal when it comes to blocking out potentially harmful virus-carrying particles.
There were huge differences.
James Scott runs a lab at the University of Toronto. He put more than 24 consumer masks through a rigorous NIOSH test. That same test is used to make sure medical-grade masks are up to snuff. With no standards or standardized testing for consumer masks, Marketplace compared its masks to the gold standard, the N95. Turns out some masks do almost as good a job at filtering out those particles as N95s, including this mask made with cotton and a type of material made from plastic. It's called melt-blown non-woven polypropylene.
Honestly, this did.
I know.
That is remarkable.
Cotton masks were an interesting story too. These 3-layer cotton masks didn't do so well, but these 2-layer ones did much better. When it comes to cotton, consider quality over quantity. The high thread count cotton masks, 600 and 680 thread count, performed very well too.
So the functionality of those fabrics is because the fibers are just endlessly crossing back over top of each other, where there are basically no holes at all, which makes it able to trap particles much more efficiently.
So what didn't do so well? This rayon mask and those gaiters that many athletes wear.
If you look at that fabric, it has very, very large pores in it. Air can simply sail straight through it.
And something Scott says is useless when it comes to stopping the spread of COVID-19, valve masks.
Air only moves through the filter part of the mask when it comes in. It doesn't move through a filter to exhale, it moves through the valve. So there's nothing to intercept those particles that you may be shedding into the environment.
No matter what your mask is made of, remember, any mask is better than no mask at all. Charles Ciagro, CBC News, Toronto.
And you can watch the full Marketplace investigation tomorrow night at 8 p.m. on CBC Television and GEM 8:30 in Newfoundland and Labrador.
Well, coming up in our moment, an act of dedication from a hospital administrator. What a top exec was willing to do to make sure patients got the medicine they needed. Well, 3-time Grammy Award winner The Weeknd will be headlining this year's Super Bowl halftime show. He made the announcement to his fans on social media, saying he's humbled and honored for the opportunity. Now, most years, there's a grand stage, hundreds of participants, but of course, the NFL is scaling back because of the pandemic. So no word yet on exactly what the show will look like, but there will be a nice Canadian touch. David Mouche is the CEO of a hospital in Windsor, Ontario, and recently he had a big problem. A patient in the ICU desperately needed medication, but there wasn't enough stock on this side of the border. There was supply, though, in Michigan, so David decided to go get the medicine himself, even taking on a 2-week quarantine to get the job done. His journey is our moment.
This medication was available in Ontario, but in 1 dose, and we needed like 7 doses of it. This was desperately needed for a patient in our critical care unit, and I had to get this medication back. I just had to fill out a form real quickly and then jump back in my car and headed back to Windsor. It was eerie at the United States border. I drove up pretty much right to the booth. He asked if I had any documentation with respect to the medication. At that moment, I was more concerned that somehow this medication wasn't going to make it back to the hospital. And I said, you can do whatever you want with me, but this medication's got to get to the hospital. They indicated to me that they will allow the medication in, but when it comes to me, I'm going to be quarantined for 14 days. I said, fine. I drove up, came to the window, handed it to him, and then I went home and quarantined.
And so he says that, he volunteered to do this in part because he's a dual citizen, so it's easier for him to go back across, and that, he did describe that scene as sort of slowing down by the hospital, putting, the medication out the window to the pharmacist and then going right home.
Because he had to be quarantining at that moment. And I mean, we should say it does underscore a pretty serious problem, right? I mean, both about the supply of this medication, but the transporting of it in these kinds of emergency situations. And we're happy to report that he has taken it up with his local MP. So hopefully they find a resolution soon. That is The National for this Thursday, November 12th. Have a great night.
Good night.